Welcome to another episode of the Doctors and Dollars podcast, where we discuss health insights and wealth secrets. I'm your host, Nate Crandall, joined today by Dr. Donna Corriel. Dr. Corriel is a board-certified internal medicine physician turned digital consultant and entrepreneur. Realizing that physicians can create significant change and impact with the help of social media, Donna created doctorsonsocialmedia.com. Today, it has grown over to 40,000 plus followers, connecting companies and patients to real health experts and helping physicians build their brands. She's also a guest speaker, a keynote, and a healthcare panelist. Welcome to the podcast, Dr. Corriel.
Thank you so much for having me.
You bet. What's going well today?
Everything's great. I'm clicking in to do this podcast and I'm excited, and I have a few other business calls, and then we are boarding a flight and heading for a vacation over the Christmas break. So
awesome. Where are you headed?
I'm headed to Florida, to Sarasota, Florida.
That's awesome. Escaping cold?
Definitely. I'm here in the Tri-State and it is cold. And so, yes, I am going. We are traveling south and we are bringing t-shirts.
Oh, man. Little jealous, but also I'm in Iowa, historically warm here. Like it was 53 degrees here yesterday.
Oh, wow.
And so, yeah, I have my sister-in-law flying into town from Charlotte, and she lands. She's like, it's the same weather here as it is in Charlotte. Like I thought we were going to get a white Christmas, lots of snow, bitter cold. And no,
Right.
Just she was looking forward to the bitter cold, and she's not getting it. So
Right.
that's right. I'll be thinking of you and all my jealousy as you're down in Florida.
Well, very good. I'm okay with that because I get to be in this cold most of the time. I'm actually also laughing because as I'm speaking to you, I glanced over at my screen and I noticed that the cow that you had, talked about right before we went on live has like the ears are coming off of my head. So I think.
Oh no.
You
Maybe
can't
just like for those listening, it's not bad at all. She's making it sound more flattering, but that's a great cow.
Thank you.
Love it. So I want to dive in. You have an interesting path to getting your medical degree. Undergrad at UCLA, got a degree in neuroscience, but then medical school wasn't UCLA. UC Berkeley, Stanford, all the kind of California choices you could have picked. You went to Tel Aviv University in Israel. So tell me about that connection and your experience there.
Yeah, so that was a very exciting time in my life. I mean, most people look back on their medical schools. I actually had a discussion yesterday with Dr. Stephen Llewellys, a dermatologist that's a member of SoMeDocs, one of the first in our podcast. And we were talking about residency. We were talking about the whole training journey and what memories he had that were good versus bad from that whole journey. And we were talking about those difficult times of medical school, feeling like you're not up to par, feeling like you shouldn't be there, the anxiety involved in that. And I, for the most part, didn't have it there. It was a really warm environment with really friendly people. And so I didn't necessarily have that, that typical medical school experience that others that went in the States had. Now it's an American program, so it was taught in English. I say was in past tense because they're closing it down, unfortunately, but it was on for many years. I don't even know, 40, 50 years and a successful program. And I specifically chose it because I was born there. And so it was a chance for me to return back to where I had been born. It was a chance for me to reacquaint myself with my culture and my religion and the traditions that I had grown up with. And honestly, it was some of the best 4 years of my life.
So tell me, I mean, American, I guess, taught in English, kind of, it's an American setup.
Yes.
But do they bring in like Israeli roots? Is there still that feeling of, even though you are in a university or on a campus, do you still get the culture of Israel and all the great things that are over there?
Oh, absolutely. So it's an Israeli program first and foremost, and then the American program just sort of happens in parallel to the Israeli program, meaning we study on a completely different track because we're also doing it the American way. It's completely Americanized. So we've got those 4 years of medical school. They're taught in English. We have all the usual things the same kind of curriculum, the same testing that the Americans take, the same visiting the hospitals. And then when the 4 years are over, the same coming back to the States. In fact, you had to come back to the States, and there were things that were lined up in the States. And, we went into the same match program. And
Mm,
again, husband and I, we met there. We both matched, in lucrative programs in the States. He matched at Mount Sinai in New York City, and I matched at Montefiore in New York City. And then, we from there went on back into the traditional American system where it came to residency. So it was just like a little blip in the journey of training that was a little different, just because geographically speaking, we were in a different country, experiencing a different, model of healthcare, but learning the same things. And again, taking the boards and up against the same tests as all the Americans, if not just a
mhm.
few more, because we were then coming in from a different country.
Just a few time zones ahead.
Of course.
Yep.
just a
Yep. Have you maintained relationships with folks over there? Have you talked to them recently with everything that's been going on over the last year?
Yes, because, I still have family there and I still
Mm,
have friends there. So absolutely. And again, it's my roots. So yes, we do establish contact. I have, many friends that are from there, and I also have very many Muslim friends as well. So I
mhm.
kind of get a bit of both sides. But again, yeah. So yes, the answer is yes, I do keep in
Yeah.
touch with people from there.
Good deal. And so your husband, is he an attending physician as well?
Yes, my husband is a cardiologist who is still clinically practicing, only because I no longer clinically practice. I do
Mhm.
consider myself still working in healthcare and making an impact in healthcare, just a different way. And that's
For
where,
sure.
yeah, that's where I was able to combine innovation with my new path and doing something that I am not only really good at, but also absolutely love.
Absolutely. So was there a specific moment, as an attending physician, was there a specific moment in time where you knew that you wanted to change your focus from attending to really use your voice to create change in healthcare from a social media standpoint? I know you're big on women in medicine and the empowerment there. Like, what was there something that happened that said, "Hey, you know what? Attending is not where I want to be. I can create a bigger impact doing this."
Yeah, yeah, there was. And I don't know that there was a specific one point in time, but I could
Hmm.
tell you that where I am now is the result of an evolution that came over me that did result from having experienced medicine firsthand, having experienced practicing using my medical degree in the traditional sense, seeing patients in a clinic and feeling the broken aspects of healthcare and being unhappy because it was so broken, and being unhappy again and again and again and again, because really being unhappy is okay. Like, some of the greatest strengths we have is being able to overcome, whether it's the unhappiness or the hurdles or the tough times in our lives. But it's, being able to overcome those hurdles again and again and again and again and again really gets to you to the point where you're like, what the hell is happening here? Like, something is not
Hmm.
right. And so that sort of pushed me into, well, first and foremost, I took a break from medicine by staying home with my third son. I was pregnant with my third child, and I decided to stay home. And I had already experienced a lot of those breaks. And during that stay home, right, during that period, I kept extending it, and I kept discovering new things that were out there in the real world that I just didn't have enough time to equate myself with when I was practicing medicine, because you're so sort of overwhelmed, like you're feeling always like you're drowning. And so, you know, I had so many new things that I was dabbling with that when I returned back into medicine, because I went back to clinical practice afterwards, and it was getting worse in terms of what was broken in healthcare. I already had these talents discovered and these new hobbies, et cetera, that I was working on the side. And so again, that evolution happened where I just became acquainted initially, and then I started dabbling, and then eventually, like, I built things while I was working that I felt were so impactful that I could pivot and do it full time and still make a difference in this world, that kept me happy.
Absolutely. And I've talked to a ton of physicians who talk about that same grind and the overwhelming day to day. And so there was probably a point where, I mean, between medical school and then residency and then, being full time attending, that you just kind of felt buried for a while and overwhelmed. And so then what I'm hearing from you say is that like you were finding joy in that, but then you kind of had that break and you were finding other things and other avenues to still have an impact, but you're finding joy in those without feeling overwhelmed.
Not only that, but I think that to call it a grind probably would be a misinterpretation because I am experiencing a grind now in the work that I do with SoMeDocs,
Sure.
right? Like we are all sort of grinding our way through the day, especially if we love, especially if we believe in what we do. And certainly when I practiced medicine, I believed in what I did and I really believed in my patients. I had great relationships with my patients. I didn't leave because anything was broken there, right? Quite the
Hmm.
contrary. I left a thriving practice and I left patients that were upset and I feel horrible about that. But at the end of the day, you've got to have a healed physician. You've got to have a healthy physician in order to be able to soak up everyone else's problems and everyone else's illnesses. So, yeah, I think that back to what you said just now, I love what I do now, and I can certifiably say that it's a different feeling knowing that you're waking up in the morning loving what you do because those barriers aren't there really. Like those middlemen that we can certainly speak about that
Hmm.
cause the breaks in healthcare and cause the health giver, the physician, to be burnt out and to want to leave and to want to retire early and to want to do things on the side because they just can't take it, right? They're no longer present in my life because I am the boss and I get to determine how my day works and what works and what doesn't. And you know what? When you own your own business, you care. You care a whole lot, and actually a whole lot more than when you're a cog in the wheel, because you
Hmm.
are in charge and your business depends on whether you care and whether you get back to the grind, et cetera, et cetera.
Yeah. Do you think that's true for, because you were in a hospital setting, correct? But then there's also the private practice side. Do you think there's kind of a difference there, or is it's all the same? There's still the patient care, there's still the health insurance providers, there's still the staffing and all the things that you have to deal with. But is there a difference between kind of the W-2 and the private practice?
That's a good question. But first, just to correct you, I don't know that hospital setting would be a good description of what I was doing. I was working physically in a practice setting. I was
Okay.
outpatient. The hospital owned it, so it was part of a hospital system. And therein
Sure.
lies part of the problem of today is that the doctor doesn't own their practice. Someone else, a third party entity, and many times it's private equity that owns your practice. And so when you ask me about private practice, I'm assuming you mean when you own your own private practice. And so
Hmm.
my answer to your question is that it depends on the model by which you practice. And there are certainly many new models that are either, have been here for a long time and maybe are just becoming more popular because doctors are getting more and more burnt down and frustrated. But there certainly are models where you're kicking out those middlemen to some degree and learning to practice without those really, really heavy burdens. So, one of those models, for example, is a direct care model where a
Hmm.
doctor doesn't necessarily work with insurance, but still makes it work. There's also concierge medicine. But again, the insurance, and again, there's more than insurance being the middleman, but insurance is certainly one of the biggest middlemen that's in the middle, and that is just not working in healthcare today. And insurance places some of the biggest burdens on care, in my opinion.
Yeah. Other middlemen would be like board of directors and leadership within in the hospital setting.
Yeah, I mean, I call it the systems. Some people like to call them private equity. I
Hmm.
call them the health systems. Another is all of all the paperwork that's required of us. Another is all the really clunky EHR systems. And another is the lack of tort reform and just the crazy amounts of legalities that are a part of. And I think that that might be a bigger issue than we are making it out to be. I think that the legalities are huge in medicine and really stifle good care.
The Physicians Financial Summit is coming to Chicago in 2024. Now, The Physicians Financial Summit is probably exactly the opposite of what you think it is. I'm sure you've gotten a free dinner and went to an event where a financial advisor shared a few things and tips and tricks. That's not what this is. You're not going to get a free dinner, unfortunately, and we are not financial advisors. This is going to be an action-packed 2 days where we break down the exact playbook that I used that allowed me to retire at the age of 33 and is going to guarantee that you are prepared and ready for a prosperous retirement. Now, there's way too much info that I can cover in this video, but I will promise you 2 things. 1, this is going to change your life forever. And 2, we are going to make this much simpler than you realize was possible. Just like you break down important and complicated medical stuff for us as patients, we're going to do the same for you. So if talking about money would make you want to pull your hair out, this is not the event for you. But if you want to see behind the scenes of how the wealthy prepare their financial futures and what you can do to be better prepared financially, then we will see you there in March 2024, Chicago.
Yeah. Do you think it was these private equity firms, these systems that came in? Has that been the change? 'Cause I bet if I talked to a doctor 40, 50 years ago, I don't know if they'd have these same qualms, I guess, or these same day-to-day issues. Where do you think that shift happened?
First of all, to answer the yes or no question, a wholehearted yes.
Hmm.
That shift happened when smart entrepreneurial people got together and saw many, many, many dollar signs. This is a dollars and cents podcast. They saw many, many dollar signs in their eyeballs and they said, ooh, let's now own these doctors, right? These doctors are really wealthy. They are, some of the biggest money makers in America, in this country. Let us own their practices so that they are beholden to us. And that's where it started. And no, you will not get the same interview with a, primary care doctor, especially that worked 40, 50 years ago, because usually they own their practice. They had a small practice. It was a mom and pop shop. And they had very close relationship with their patients. They were able to give as much time as was necessary for each patient. They were also responsible for the staff. So the staff had respect for the physician. And it just worked, in my opinion, more beautifully, more magically. Now, were there problems then? Of course, there's always problems. You're never going to get a perfect healthcare system, but you're certainly not going to get a good healthcare system when you are marginalizing the physician, picking them up and putting them outside of the decision-making, right? And you are giving the decision-making to CEOs and entrepreneurs that are sitting at the top, completely removed from the actual transaction of medical care. And that, to me, is what represents the change that's taken place in healthcare.
Yeah. Well, I'm glad to see that you're making a positive change, right? It's hard to go in and tackle, the man, big brother that's out there, but you're making a change on the physician side of things. So SoMeDocs began in early 2017 with the idea of using your knowledge and experience in medicine as a board certified internist, and then marrying it together with what your website calls your mad skills that your kids told you had to say, your mad skills with social media. However, I mean, I know a lot of physicians, they are typically reluctant to embrace social media. So how have you lowered those walls to help build such a large following with SoMeDocs?
First of all, I'm laughing. I don't even know where you found that mad skills quote. You say things like years ago and then you cringe when someone brings them up. This is that case.
Yeah, I'm really good at preparation. I make sure I'm prepared.
I love that. All right. How do doctors get over that fear of social media? How do I convince them? So in order to convince anybody, right, of something, you've got to hit at the core of their needs, right? And I'm not doing this in a salesy way. I'm not doing this in a marketing way. I am a physician that had those needs and I found a solution for those needs. Now, it's not a perfect solution, but it's part of the solution. And my goals have become to explain to doctors, to show them why this path is part of our solution for taking back medicine. And that involves, owning your own identity, owning your brand. In today's world, those words make sense. They would not have made sense 40 or 50 years ago because there was no way of owning your identity in the way that we have today. So owning your identity, owning your brand, and then building up your brand is a huge concept. And the way that I truly convince doctors is to show them, look, this is what you can achieve when you actually do this, right? One of those things being that, and this is very powerful, that because the systems now own us, right? Most of us are still employed and many of us are unhappily employed. If you ever decided to leave, or if, heaven forbid, the system decided to fire you, right? It would be very difficult for patients to be able to find you or to follow you. But creating an online identity and creating a brand online allows your patients to actually follow you. It makes the physician and it makes the doctor the centralized figure, the celebrity, so to speak, of healthcare and not the health system. Like, you're not going to stay in health system X because when your physician leaves, right? So you're going to probably want to go to health system Y if it's within a driving distance, if you really love your physicians and you've developed a relationship with them. And that's the key to me. And that's, to me, the key to health is continuity. Is, you know what, I really love this physician. So if they're no longer working for health system X and they're working for Y, it's a no-brainer that I should be going to health system Y. But the health systems are smart because, again, they've got entrepreneurs leading them, and they have devised ways to cut essentially that cord of the patient being able to follow the doctor. And that, to me, is where building identity online, building a brand, and building followership, that's what it's all about.
That's what I love what you're doing. And I was just telling my wife last night, I was telling her about the conversation that you and I were going to have today. And right as we were talking about it, a drug commercial came on TV. And I was thinking celebrity. And so it's so funny, the word that you said, celebrity, that it should be more important that there are doctors at the forefront and are known for, well, your husband's a cardiologist. Let's say there's some heart medicine. It's the heart medicine that they pay millions of dollars of advertising for on TV, when they should be promoting the cardiologists that are actually doing the work, or the folks that are helping or healing the heart, like you talked about.
Amen.
That should be the celebrity.
First of all, freaking men. And I'm going to keep it PG here. Freaking men, because that's not what I want to say. Okay. Freaking men, because that is what SoMeDocs is about. Like, I am so sick, right, of doctors being put down, being disrespected. And again, with all due respect, like, they go through and when I say they, I mean we, I mean, I did too. I'm just no longer practicing. They go through so much in their lives. They dedicate so much of their lives to becoming doctors. They have so many missed opportunities. And if you haven't walked in those footsteps, then you really don't know. You can complain all you want. You can say we're whiners. You can say whatever you want to say. But unless you have dedicated yourself to medicine and to becoming a physician and know just how difficult that treacherous journey really is, you will understand why at the end, when you come out of it and you're thinking that you're golden and you're like in a rainbow. And again, that doesn't mean that you don't want to help people. Quite the contrary. You're now armed and ready to help people, but instead you are disrespected and you're owned by someone else and you're being told how to practice and you have to fight for your patients nonstop and you come home exhausted and you're constantly thinking that you might have regretted going into it. That's a broken health system. A broken health system is one in which the doctor is unhealthy. The doctor needs to be the healthiest one because they are loving what they're doing. They are loving their patients. They are connecting with them. And that, to me, is just a beautiful relationship in any field, right? You want someone who is...
Absolutely.
Yeah, when you go buy a shirt at the Gap, you want the salesperson ideally to have a good attitude. You want them chipper. You want them excited, and you want them to make you feel good as the customer. You know who's got this right, by the way? Who's got that concept right? Is Disneyland and the Disney, right? The Disney business, right? And I know that because secret, I worked at Disneyland when I was a teenager, and I loved the concept that the workers are happy going to work. It's a happy place. It is a place where people are happy, the customers are happy, the people are happy, and you make them happy, and everyone is happy together. And that may sound unrealistic, and it's of course it's not healthcare, because people aren't happy coming in. They're sick and they're miserable. But if we can do our magic being doctors and turn them around to being healthy and happy, or at least giving them the time and the acknowledgement that they need, or at least show them that we are partners with them and working to better them, then that makes more of a Disney environment.
Mm-hmm.
And right now, healthcare is anything but a Disney environment. So just imagine a Disneyland or a Disney World where the workers are not happy and miserable because someone is sitting on their shoulder constantly telling them what to do. And they're responsible for every interaction on top of everyone telling them what to do, et cetera, et cetera. So
absolutely. I mean, imagine even the patient experience. If the doctors themselves are happier and feel needed and loved, by both their employer, but also the patient. But imagine the patient experience then to come in and say, man, I know that something's going on with me, or I have this, or, I've already talked to you, doctor, several times, and I know I have this diagnosis and we're going through this treatment. But if there's just that positiveness from top to bottom.
Yeah. And I know what it's like because I'm a patient too. First of all, every doctor at some point becomes a patient. Sure. I very much know because I am very much a patient, and I have very much experienced myself many, many breaks in the system. The frustration, the feeling of just, I cannot stand going to the doctor, and I cannot stand the doctors. Of course, like even me, I have experienced taking out my frustration and anger on the doctor themselves. And that's the clever way that the system has built it, actually, is that the doctor is the front facing person. And so when you are angry at the system, you're not angry at you're not angry at the right people. You're angry at the doctor, right? When insurance behind the scenes holds up a treatment or doesn't, approve it or whatever it is, many times it seems as if the doctor is lagging, or the doctor's not doing it, or the doctor didn't fight hard enough. But people don't actually know the truth, and it's to the detriment of the doctor, and it definitely benefits the system, the insurance companies, and everything else in between that actually is hindering that really good health delivery.
Absolutely. Great points. As I think of doctorssocialmedia.com, also SoMeDocs, we're creating a voice for doctors, right? We're building a brand. We're getting them to become known. One, I think the biggest point is to let them, it gives them an opportunity to express their knowledge. It allows them to help more people versus, let's say we keep giving the analogy, the 40 or 50 year ago doctor who primarily practiced in their town or maybe their county. And that's where they were known as the doctor, where now, that doctor may have been profound and had all these amazing ideas, but wasn't able to get those out to the world 40, 50 years ago. Well, now I feel like SoMeDocs is an opportunity for doctors to share their knowledge and get their voice and their ability to help other people to a much broader audience. Was that really the goal of when you created SoMeDocs? Was that, or tell me a little bit about what SoMeDocs is, and then what you see as like the genesis of why you created it.
Yeah, so SoMeDocs has so many goals that it wants to achieve. At the end of the day, what ties the concept all together is that I want to promote the autonomy of the individual doctor. That's at the end of the day, the crux of why I built SoMeDocs. And I wasn't even really able to say that until maybe a few years in, because I don't even know how to explain it. I just knew that something was broken. I didn't necessarily know like in what ways it was going to evolve, but I knew that it needed to be created. I also didn't know how to create it because back when I started it, I didn't have the mad skills that I have today. I did gradually take the time to develop those skills. It's so funny because I had a consultation yesterday where I was helping a physician, and she asked me, how are you keeping the price so low? Like, it makes no sense, right? She's working with all these consults and with all these like entities that charge, ridiculous amounts compared to what we charge. And she was in shock because I was taking her through and she was like, oh my God, I cannot believe how much is available. And I said, yeah, listen, I am building and this is relevant to your question, I am building a Walmart model. I always call it a Walmart model because the price is low, but you're delivering items that I believe are quality. I mean, that doesn't always fit because I don't know if Walmart really delivers quality or doesn't deliver quality, but the point is that it delivers goods that are sustainable at an affordable price, right? So for me, I want to be able to spread as much goodness as possible to both the physician population, to the doctor population, I'm going to say, not physician, because we've opened up now to also dentists and podiatrists, and we're contemplating opening up to many more with a new section coming that's for students. So we want to spread as much as possible of all of this new knowledge that's out there and all of these new tools to the doctors, but also do that to the patients. We cannot make a difference in healthcare without the patients behind us, right? And as long as they are looking at us as an enemy, and I say that because we've been vilified to some degree by these middlemen, as long as they look at us as the enemy, we will not be able to do it. So SoMeDocs is built sort of for that dual audience. First and foremost for the doctors who we have been focusing on more, right? So we built a community that, different interactive communities for doctors on Facebook, for example. We have a smaller community that's we have membership on the site that's free for doctors from this country with active NPIs. We also have a Step Up community, a membership that is for doctors that want a little more. So they want to grow presence online. Maybe some of them have businesses, private practices. Some of them have things that are non-medical that they're growing, et cetera, et cetera. But then another part of the website is that the website's public. So we've got a magazine on the website and we constantly publish articles and videos. And soon we have a growing podcast so that the patients can learn too. And the patients can learn again directly from these doctors. So
that's awesome.
So that's the key, is just teaching these doctors that in their hands, there's power. They just may not recognize the power because they're sort of stifled by these systems and very busy, but that you can break the chains to some degree by building your own brand that's owned completely by you. That's important for me to say, because I always counsel the doctors that when they're building a brand, they need to be completely upfront with their employers, and they have to make sure that it goes into their contract, and that also what goes in their contract is that they own 100% of that brand or whatever it is that they end up negotiating with their employer, right? Because some employers may say, I don't want you to have 100% of that because X, Y, and Z. I want to own 10% of it. And I don't know. And again, negotiation factors come into play here because maybe, it works to your advantage to give some equity away to your employer because then they'll let you do certain things, et cetera, et cetera. Maybe you don't need them and you'll create your website and your podcast outside of work hours and it'll be 100% yours. And so when you leave them, you won't have to pay them anything. So there's so many different ways to do this and to build brands, but there's so much impact to be had from these really knowledgeable doctors of today.
Absolutely. So you mentioned it's free to physicians in the United States that have an NPI. But there's also kind of that next level of, hey, if there's more that you want assistance with, I'm guessing that's some level of paid membership. Is that where some of that business acumen that you were just talking about, many physicians just don't have that because it was undergrad, medical school, residency, it's all medicine focused. Yep. They don't take business classes. They don't take finance classes and things like that. Yep. Is that some of the assistance or some of the strategy that you guys are talking in that next membership up above the free?
Yeah. And marketing goes in that too, right? Like not everybody counts marketing in business. It's so interesting that I actually wrote a few articles on the topic and suggested it on social media and kind of used what people responded to me in the article as quotes, is that I do believe that there needs to be some like mild, small, but like some business training in our medical journey. And note that I mentioned that we have a student section coming up on SoMeDocs, and that is important to me for this reason, for other reasons. But yeah, I think that business marketing is extremely important, especially nowadays. Again, 40, 50 years ago, it was still important when you had your own practice was business because you had to stay afloat. But, you hired people to come in and help you and it was okay. Now you are owned by those people. And that puts the power in the wrong hands. The power needs to be in the hands of the doctor that's actually doling out the care. So yeah, I think business is very important. And yes, for that paid membership, and again, everything's constantly evolving, changing. The price has risen a bit over the years, although again, it's extremely low, like was commented yesterday by a physician that was using it that saw all of the different things that she could take part in. So it's extremely low. And I do that because I want doctors to really start building their own brands and understanding how and coming in. And if they need to do it for free on our site first, then no problem. And if they want to stay there, that's fine. At least for that free option, we've got a directory where we're promoting third parties like podcasts like yours, which I think that you've used the directory and you're, going to give me a testimonial. I'm excited about that. But we've had, different really great, like we've had the Wall Street Journal use it, and we had a startup using it that is paying their advisors now, and they got their advisors from the directory. And so that's the beautiful magic that I'm hoping to achieve through the SoMeDocs website and platform. First and foremost, that free directory where I can showcase, hey world, this is a free and publicly accessible directory of the actual experts of health. I have verified them. We verify each one, hand verify them. They are who they say they are. They're medical doctors, they're DOs, they're dentists, they're podiatrists, and maybe more in the future. And you can now directly contact them, right? In the old days, you wouldn't be able to. A doctor would need like a publicity team. But nowadays, you don't need it. And also in the old days, doctors didn't necessarily feel like they wanted to give their time to getting quoted or being advisors. And nowadays they do want to do those things. So again, so much of the world and the realities of today have changed. And SoMeDocs and what it offers, it basically just fits. It accommodates itself to the growing times, to the evolution that's going on. And it teaches the doctors like how to do things.
Absolutely. Yeah, you mentioned I'm definitely giving you a testimonial as far as how well it works. It's so streamlined. It's very easy to use. And I'll say this even in my testimonial, that like the ease of use is great, but also the concentration of it. Like I didn't want to, as I was building this podcast and only interviewing physicians, I didn't want to be concentrated on one specialty, right? And so the ability to sort through anesthesiology, cardiovascular, all those different specialties that are out there so that I'm not leaning in one way, right? The search function alone has been fantastic. And then just the breadth of physicians that are on there from many backgrounds, many different schools that are all, maybe are not as adept to get into the business side of things, right? There may be ones that are just starting out on the business side of things and the promotion. But then you have the ones that you go out to LinkedIn or Facebook and they have thousands and thousands of followers and they have a message and a very strong message to give. To be able to connect with those people in that inquiry, just write up a quick inquiry. Hey, I think what you're doing is fantastic. I'd love for you to be on the Doctors and Dollars podcast. Like that direct connection is so great.
I love it. Thank you. I'm so excited to hear your testimonial and to share it, because really, first of all, you're talking about diversification, which is super important. And that is part of what went into my creation of both the directory and the filters that are involved. It goes even further than just their specialties, because first of all, even just patients can use it because there's still the geographical search box. So if you want to find someone in Iowa in a particular city, you can put in either the zip code or the name and find someone that's within the area. But
so good.
Right. But even more so, there's unique filters that work for third parties, like, for example, a startup, right? That's maybe looking for advisors, or maybe they're looking for someone that has certain social media presence. So you can look for someone that, let's say, is a cardiologist that has a YouTube channel. You can literally pick all kinds of filters to work together and really niche down on that search for those niche down search results of the cardiologist that maybe is on YouTube, that maybe has written a book. You can kind of play with the filters and use them together to find the right combination for your project. So that to me was really important. And of course, it's not straightforward. And I'll tell you that, again, the difference between that and LinkedIn or Facebook or whatever social platform is that there is a real human behind it actually running it. I kind of think of myself as the wizard in the Wizard of Oz, except I'm like this behind the thing, but it works. Like I am not pretending, and I am not kind of fooling anyone like the Wizard of Oz is. And I'm not making I will not make promises that I can't keep. And that's the beauty of SoMeDocs, that you've got someone holding your hand there. When you're submitting your profile as a doctor, you aren't just submitting it and pressing, send, and then it just creates a profile. You're submitting it to the human behind that picks up and that makes sure that everything's working, that the photo is not pixelated, that it sits right, that, so it's like a level up from the social platforms that are available today, because there's actually somebody that's editing and optimizing the site.
Yeah, that's good. Tell me about for our physician listeners who are now curious about SoMeDocs and are going to go check it out as soon as they listen to this episode. Tell them a little bit about the experience that they get coming onto SoMeDocs, the interaction that they'll get maybe on the free side of things, and obviously outreach from podcast hosts and things like that. But even on that paid level, as they're trying to really build their brand, what's that experience look like for someone that's curious about SoMeDocs?
Yeah, great question. So free members, they will sign up and then they will be asked to submit a profile form within the first 30 days. Now, we basically changed the rules recently to say, you know what, you have 30 days to submit that profile to be in the directory. And if you do that, great, you get a profile built and you're in, and you're good for a free membership. If you don't do that within 30 days, we remove your account. You then have to come in as a paid member, but we have like a lower paid membership that you have to pay. The reason for that is that we do a lot of work on our end. When you submit a request to come in for free, we have to verify you. We have to activate it. We do things. And so to do that for free is work on our end, and that's fine once. But after that once, if it's not important enough for you to build that profile within the first 30 days, then you really probably don't care and don't, value our time again, which is something that we teach the doctors as well, is to have your time valued. So you have to do it after that. But the point is, you'll get a profile built. You can join the Facebook group that we have going right now. Is called Dr. Side Ventures. It's really exciting, and it's on Facebook. You can submit articles that may get published and circulated on our social media platforms extremely uniquely. You get to do all kinds of things that I just can't think of right now for free, but again, to a limited extent. Yeah. And then if you decide that you want to be in that elevated membership, it's a totally different ballgame. And as soon as you come in, first of all, you don't have to build your profile within the first 30 days. You could do that whenever you want, but you join a community. We have a Facebook group that's just for network members. So it's like a very compact group of doctors that are serious about building their brand and their business. That's we network and we hold an incubator every 3 months. That's extremely powerful and useful. You get an onboarding consultation with me for 30 minutes where I get to guide you through, well, what are your goals? And then let me screen share and show you what you can use on SoMeDocs, because there's just so much you can do. And there's a lot more. We have pods, we have all kinds of things. And the doctors that are involved there are always in awe of just how much I've built when they hop on a call and I show them.
Yeah. Sounds very interactive. I mean, it's not just people earlier in this episode might have thought like, okay, she created SoMeDocs, which sounds like a Facebook for doctors. And as this conversation has evolved, it sounds like much more than that. It sounds like a tight-knit community where you guys are helping each other, especially if you're sitting down for 30 minutes and showing them like, here's all the things that we can do. And you may have had a baseline knowledge of how to build a brand. We're going to expand on that.
Totally.
What an opportunity for physicians to have that.
I appreciate it. Yeah. And we're not a Facebook. And note that we use Facebook. We use it just to interact. I don't really care if Facebook goes away tomorrow. and I need to build my community elsewhere for interaction. I just use it as a tool for interaction. And that's important to learn for your listeners, right? This is a good tip, good advice, is that take the tools of today and use them for your own benefit, for your own good, right? And that's how you can also, you build a business using those tools, but building a business of your own. So yeah, it's not a Facebook. It's not necessarily like, it's not a platform where it's not a platform just for interacting. It's what you do with that interaction and the brand that you build. That's, the key.
Yep, totally makes sense. So that was for the physician listeners. For other individuals out there, the non-physicians, are there opportunities for people who hold events or for companies to promote on SoMeDocs so that they have access to your physician community?
Yeah, I mean, there's advertising and sponsorship. So in that regard, it's very similar to Forbes and to the New York Times, right? There's a space where doctors are present and doctors are interacting, and you could certainly advertise because we do have a magazine. So first of all, for that cohort of the general population, that's the public that wants to see what the doctors built, it's free and it's accessible. And there's a newsletter, and we've now split the newsletter into a newsletter for the public, right? So more leaning towards health and things that the public may be interested in versus a newsletter for doctors where we're like, here's the services that you can use. Here's a doctor that's built this, et cetera, et cetera. And yeah, then we work with third parties who are like, I'm not a doctor, but I'm building something, a service that a doctor can use. Great. There's advertising and sponsorship. And I'm most likely going to go ahead with a membership for those third parties where I build a similar directory that the doctors can look through themselves and pick the right help for them.
Gotcha. So I'm going to shift focus a little bit on you, if that's okay. We're going to make this one about you. So you've been a guest speaker, a keynote speaker at several conferences. I too have gotten in front of bunch of people and led things, teaching, educating, things like that, but also gotten in front of large groups to speak. What's your process in preparing to speak in front of large crowds, especially large crowds of physicians and healthcare leaders? What's kind of your process in doing that? Everyone has one.
Right. That's a good question. I have always hated public speaking.
Same.
Right? I have always cringed. My heart beats at like 150 beats per minute, maybe 200 sometimes. I get very anxious. So in the past, a great tip is a nice little propranolol, which is a beta blocker medication that's taken right before. And I'm sorry about the ringing. That's my text. I don't know how to turn it off. But okay. Propranolol, nice, good old propranolol really helps. A touch of it helps right before a presentation. It lowers the heart rate just a little bit to make sure that you can go on. And it really makes you less anxious. Of course, a physician has to prescribe it. So a physician has to agree that you don't have any medical conditions, right? You know what it is that really gets me through presentations that are in front of a large audience is just kind of like believing in myself and reminding myself that sitting in front of me are humans just like me. I don't need to impress anyone anymore. That's a little shift that happened sort of throughout the evolution of me becoming an entrepreneur, right? Because as a physician, you can't really make mistakes because you're dealing with health and human lives. But as an entrepreneur, you absolutely can make mistakes, and those mistakes are going to make you stronger. And I love that. I love that I no longer like have to be perfect. I can be, imperfectly perfect, and I can go up in front and my heart can beat, but I'm still the expert in what I am delivering and the message I'm delivering, and I know what I'm talking about, and that really helps me to calm down. Some people say like focus on one person in the audience. I don't know that helps me so much, but again, I don't know if I'll ever love publicly speaking, but I think I pull it off the more I do this because I truly believe in myself.
Yeah, that was beautiful advice. I had the same kind of thoughts back when I first started doing it. I used to provide education to like young financial advisors, and it would get very specific from a topic standpoint. And so I always felt like, man, I need to knock this out of the park. And like they are entrusting me to give them the exact right information. And so, yeah, same thing. It put a lot of pressure. I put a lot of pressure on myself to do that. But then, yeah, I just got to the point where it's like, you know what? like they can always ask questions later. If I don't deliver it perfectly, if I stumble through something, or if I don't make enough eye contact, like if somebody truly cares about what it is that I'm saying, like we'll have a conversation that's not in a large setting. Like that was kind of always my thought. And so you may have those same thoughts as you get in front of, large crowds. It's like if something truly was impactful, they'll come and talk to me later about it. I don't need to try and impress them while I'm on the stage.
Totally. And they do. And exactly. That's a good point also. I know that the people that really care about what I'm talking about are listening because they care about my advice and my tips. There will always be, if I'm talking to a physician audience, especially, there will always be physicians that don't want to build a brand currently and honestly don't always understand it. I've had actually a lot of negative feedback and particularly from a Medscape article, right? Medscape, owned by WebMD. They reached out to me when I announced that I was leaving clinical medicine. Then they asked me to write an article, and they asked me to write about something specific. And so I did. And I got a lot of support about leaving clinical medicine. I also got a lot of hate, I will say, and critical messages, and just messages that were very harsh. And at the time, I really cared. It hurt my feelings because, again, I was in a different point in my life than I am now. Now I really don't care about the hate. And I truly believe that people that are hateful and that have negative messages, they don't always understand the exact specifics involved, both in my life and in what's broken in healthcare and why we need to do something drastic, like not necessarily what I did, but like building a brand in order to change the healthcare trajectory and how it works. So again, there will always be people that don't understand you, people that are negative, that hate. As long as you believe in what you do, as long as you're good intentioned, as long as it's succeeding, you'll do great.
Absolutely. I think the only way to avoid that hate is if you just had a camera crew following you around that were in patient rooms with you and with you at the clinic. And then in your living room, as you talked about all the things, it's like, hey, I need to make this change and get out of being an attending physician. And like if they were there for those, they'd be like, okay, I get where she's coming from.
They might. If they lived in my shoes, I think we could say that. But I think
point.
no one's ever going to get 100% support. There will always be haters. Even we talked earlier about where I'm from. Like people listening to this podcast may say, you know what, she's from there, I'm not listening. Like there's always going to be hate of some sort that's based on your own biases and your own experiences. And that's unfortunate, but I'm hoping that there's enough open-minded people out there that are willing to embrace the innovation of this world and the new, that can step out of the traditional box, right? And think afresh and allow yourself to change your viewpoint and your life for the better.
Absolutely. That's a medical technology that needs to be invented, is the ability to take someone from one spot and put them into somebody else's shoes. We can create a medical device that does that. Put someone in somebody else's shoes.
Yeah, and I'm sure that there's going to be a Black Mirror episode that comes up with that, because they've come up with like everything.
Absolutely, I love that show. It's so good.
Me too. Have you seen the latest season?
I watched the one that had like Selma Hayek in it.
Yep.
Which I think was episode 1 of the latest season.
It was episode 1. You've got there's one in there with the guy from Breaking Bad. I forgot his name, not Bryan Cranston, but
I have not. Yeah, the other guy. I haven't seen that one.
Highly recommended, where they go up into space. I'm not going to say what it's about, but I will just say you should watch that one because it's powerful. Yeah. Yeah.
Every episode it gets done and I'm just like, whoa, like
no, me too.
It feels so real that it's like that could definitely be in the next 5 years. Yeah.
Well, to those listening who have never watched, just look up Nosedive, which is the episode with Ron Howard's daughter, Dallas Bryce Howard.
Yes.
That is relevant to today's world.
Yeah,
right?
Absolutely. Absolutely.
Yeah.
Well, thinking into the future, here's the final question for you, Donna. What's next in 2024 for you, for SoMeDocs, for everything that you have going on? What's next?
So what's next is that we're building when I say we, I mean me. I'm building a student section. And when I say we, I also mean the doctors behind SoMeDocs, the members. The members make up SoMeDocs. I'm the one that just builds it. I'm the founder and the builder. I make it run from the website, from the tech perspective, but the doctors help to make it run from the let's fuel it perspective. So what's next is a student section. We've got a new job portal, job board coming up that is new and innovative. The members of SoMeDocs will be able to post their job listings there, and it'll be front facing and hopefully help them to fill the spots in their private practices, et cetera. Like I mentioned, we might have a directory for people of the trade, for third parties that want to give their services to doctors. We may or may not extend to other healthcare professions within the healthcare system. So I don't know yet if we're going to have a directory for nursing. Maybe we'll have a directory for, for optometrists, right? Right now we've got a doctor directory, we're going to have a medical doctor directory specific. We're going to have a student directory. I will possibly just build out directory based on degree so that, again, there's full transparency. The third parties know exactly who they're getting and what degree when they come looking for their, experts for their projects. But just growing the users of SoMeDocs, the readers of SoMeDocs, and doing it in a transparent way, in a way that actually makes impact in healthcare.
Well, I'm excited to see those changes. I will continue to use SoMeDocs even into 2024. I think it's a fantastic platform. I thank you. I'll speak on behalf of physicians that are on it. I thank you for creating it. It's a fantastic tool that is just going to get even bigger. And I thank you for coming on the show today. We're recording this a couple days before Christmas, and I know that you're heading off on a family vacation. I hope you have a wonderful Christmas.
Thank you so much. Merry Christmas to you as well.
Cheers.